This is Brady Blackburn with the North Carolina Medical Journal. I'm here with Jessica Beach, a doctorate in public health candidate at the UNC Gilling School of Global Public Health. Jessica, thank you so much for joining me today. To get us started, could you introduce yourself and tell me a bit about your background?
Yeah, sure. It's great to be here today. I've been working in the managed care space for Medicaid beneficiaries in Arizona, North Carolina, and Washington since 2018. A lot of my initial experience was actually in the space of tribal health and tribal affairs, and really focused on families with young children. And that's what first got me interested in Medicaid because so much of the work that I did in the tribal health space with the organization I was with at the time overlapped with Medicaid for young children and their families. And so from there, I had the opportunity to start working in managed care, learn more about it. And since transitioning to working more on the managed care side, I have focused a lot on maternal and child health and family experiences in Medicaid. And so that's, one of my passions and the things that I love most about my job.
So, what initially drew you to work in healthcare and maternal health?
Well, first of all, I'm a mom, so there's an easy connection there. I have 3 kids. And knowing just a lot of the disparities that exist in underserved communities, like tribal communities and rural communities, I have just been naturally drawn to how do we leverage Medicaid as a program, as well as other resources from the federal and the state level to influence and improve health outcomes for families who are navigating these systems. Healthcare is really complicated, and navigating it is really complicated when you layer on chronic health conditions, risk, historic distrust of the systems that you're navigating. It can be really challenging to know what works well and who's doing what. Um, and I think that navigating those systems myself with my family, watching my friends do the same, and now my professional role, kind of seeing it from the provider side, the state plan side, and kind of seeing all of those different pieces. It's really continually drawn me to how do we use these systems to improve family health outcomes and support families in how they feel supported, how comfortable and confident they are in navigating their care journey.
Could you tell me a little bit about your current work, both your professional work and your academic pursuits?
Yeah, absolutely. So some of the things that I'm currently working on professionally and academically is really understanding that piece of how does managed care support our members in Medicaid in having better maternal and infant health outcomes, recognize our members' goals and help them achieve their goals throughout pregnancy and beyond. I'm really focused on how we make the most out of the postpartum period. So how do we take advantage of expanded coverage to create strong health? How do we leverage postpartum coverage and expanded postpartum coverage to continue this engagement in healthcare and so in a mom's personal health just as much as she was during the pregnancy period? So folks are going and accessing healthcare a ton while they're pregnant, and then you have a baby and it kind of drops off because your priorities have shifted a little bit. And so how can we make sure that mom and the family overall stays really engaged in their healthcare? And I think that's where a lot of my work is focused on right now. So what do we do? What does managed care do? What do providers do? Who are the partners that are really critical in making that happen? I think that's really where I spend a lot of time in my work.
Great, thank you. So, I want to turn our attention to North Carolina's Medicaid for Pregnant Women program. Could you tell me a little bit about what North Carolina's Medicaid for Pregnant Women program is, who it covers, and why expanded access to Medicaid during and after pregnancy is important?
Yeah, sure. So, pregnant Medicaid for pregnant women in North Carolina is really similar to pregnancy Medicaid in a lot of states. It allows for expanded eligibility criteria to the Medicaid program for folks who are pregnant. Um, Why that's important is because pregnancy care is critical, and that's a big piece of overall health and wellness positive health outcomes for mom and baby. That just is not there when you don't have access to care. And so the increased eligibility allows for folks who may not generally meet Medicaid eligibility. It allows for them to enroll in Medicaid so that they're able to access care while they're pregnant for themselves. And then the expanded postpartum coverage is important because it allows for families who would drop off of Medicaid eligibility after the standard postpartum period to still access care for themselves up to 12 months after pregnancy, which is really crucial for continued support after the end of a pregnancy, re-engagement in primary care and preventative care, and really setting an entire family up for positive health outcomes.
Gotcha. So your experience includes working in maternal health in North Carolina and Arizona and in Washington state. What has your multi-state experience taught you about North Carolina? What makes our state unique and what can we learn from other states?
I think my work in multiple states has definitely shown me that North Carolina is really unique in some ways, but that there are also really similar barriers nationally, kind of wherever you are when it comes to Medicaid and pregnancy Medicaid. I think some of the things that make North Carolina really unique is the case management structure for people who are pregnant on Medicaid. Typically, in states that have Medicaid managed care, you'll see at least a portion of that handled at the MCO level. That's generally not what happens in North Carolina. Also, North Carolina has a decentralized local health department structure. And so that is a little bit different from some of the things that you may see in other states, and that can impact how a local health department is run, who does what, the structure. I think that's something that I've seen that's a little bit different. But I think the reason for that is because the program in North Carolina is really responsive to the experience of North Carolina and what families in North Carolina need and are looking for in their Medicaid experience when they're pregnant. I think that the delegation of care management or case management helps to keep families connected with resources that are local to them, maybe their provider who they're more familiar with, someone they're engaged with regularly. And I think that's really a helpful component of it. I think comparatively, some of the things that we see there that I've seen that is similar is a lot of the barriers and just awareness of things like expanded postpartum coverage. Not everyone knows. There's not an easy way to promote it, especially if it's something that is somewhat automatic in terms of you just become eligible for it. It's hard to build that awareness. And then I think we tend to see less utilization of those benefits. Also, something else that seems to be a barrier across the states that I've worked in is access to behavioral health services when you're pregnant. That seems to be something that nationally a lot of states are struggling with in terms of access and providers who are specifically prepared and willing to serve people who are pregnant.
You mentioned managed care is something that makes North Carolina unique. Could you tell me a little bit about how managed care organizations should support pregnant people with Medicaid insurance?
Yeah, I mean, I think that there are a lot of great examples in North Carolina of how managed care organizations currently and or should support Medicaid beneficiaries. There are the connections to local community resources that are kind of specific to the unique needs of pregnant people and their families. I think that, having being intentional about identifying those resources and having like a systemic way to connect people, leveraging all of the systems, right, that exist within North Carolina to do that so that we're constantly kind of reconnecting folks back to their local community where they're able to locally get the service. And then also having really strong responsive relationships with those delegated case management entities for folks who are high risk so that that communication is there, the transitions are there, so that the points along the timeline for someone who is pregnant, they're getting the attention that they need, and those relationships are there so that there can be the smooth sharing of information across the board.
So we've talked a little bit about some barriers from navigating the system, understanding eligibility, and even understanding what services are included with your Medicaid insurance. What are some of the most common barriers you see for individuals trying to enroll in or navigate the Medicaid for Pregnant Women program?
Yeah, I think that some of the barriers that I've seen most often are probably connected to access to certain types of services. I think something that is maybe not unique to pregnancy Medicaid, but is access to care in rural areas. We have a number of maternity care deserts in North Carolina, so how does that impact your access? I think something that has been a trend nationally is providers who are accepting of Medicaid. And so ensuring that, just because a service is covered, if you can't find a provider locally who will actually serve you, that is a challenge. And so, how do we navigate those barriers with an eye to like what beneficiaries need, like what Medicaid members need? So, I think those are some of the barriers. Access to services. I mentioned earlier behavioral health services. It's a really critical time to engage in behavioral health treatment if there is a need. I think particularly for folks who have maybe substance use experience or a background of that, sometimes it's harder to get access to those services when you're pregnant because providers are hesitant to serve pregnant people. And then I think in more global perinatal behavioral health, there's not as many of those providers across the state. I don't think that's necessarily unique to North Carolina, but it is a challenge when you're thinking about how do I ensure I'm getting the best possible access to high quality care when I'm pregnant.
Absolutely. And as the second largest rural population in the country, I think what you're mentioning about rural disparities in particular are uniquely felt in North Carolina. So, from your perspective, where do you see the biggest opportunities to strengthen Medicaid coverage or care delivery for people during pregnancy and postpartum?
I think the biggest opportunity, one workforce development, because a lot of the barriers I mentioned it's not just an issue for Medicaid or an issue for rural North Carolina. It's an issue that there's those providers don't exist or that there's really limited access to the providers. So I think workforce development is really critical. I think responsive rate setting is really important in terms of like getting as many providers as possible to accept Medicaid. And I know that that financial component is always a barrier, especially, with where we're at right now. But I think those are some of the big opportunities. I think also, coordination of services locally, building awareness of the resources that exist, strengthening relationships between those resources. And there are a lot of great examples across North Carolina where this is happening at the local level, and kind of working to break down a bit some of those silos that we see between systems, right? And so I think there's a lot of great examples out there in North Carolina of that happening to address like some of this care navigation issue. I think that also the local health departments are really great with helping to support some of that navigation for all Medicaid beneficiaries, but especially for pregnant families. So I think just kind of building on those opportunities, um, continuing to fund expanded postpartum coverage is a really critical piece of a lot of this as well. So I think there's definitely a lot of opportunity to address these barriers.
Next, I want to talk a little bit about some policy changes, both at the state and the federal level. In 2022, North Carolina extended postpartum coverage under Medicaid for pregnant women from 60 days up to 12 months. The legislation that authorized this extension also allowed NC Medicaid to add new coverage, including for oral health care, which had previously ended at birth. Why is postpartum coverage important, and how does something like an extension from 60 days to 12 months, how does that help people access the care they need?
I mean, where to start? There's so many kind of critical pieces within that 12-month window. Before the expanded coverage, we would see, like you said, at the 60-day mark, that's when Medicaid coverage would end. I think that what we've learned about maternal mortality and morbidity is that that's not enough time for someone to have not have access to a provider, right? We look at maternal mortality and morbidity in the full, 12 months after the end of a pregnancy, and to lose coverage at 60 days, and not have access to care is really detrimental to so many that are on Medicaid. If you don't have access to a provider, you're probably not gonna go because you're scared you can't afford it, and that contributes to people dying. So having that extended coverage is really, really critical. I think some of the other issues that it touches on with the expanded access to postpartum care is that it gives people time to reintegrate into normal health access behaviors, right? When you're pregnant, you're going to the doctor really, really frequently, even if you're not high risk pregnancy, you're following a set schedule of appointments, you have a baby, and now you have a baby, and the baby has all of these appointments. And you ideally have at least one postpartum visit. But after that, you're kind of disconnected. And so the extended postpartum coverage for Medicaid also creates a great opportunity to continue that care journey, get re-engaged with a primary care provider, especially if you maybe have a chronic condition, a behavioral health need, just kind of making sure that you're still getting the things that you need, and focusing not just on the baby, but on the health of the mom. And so I think that's kind of the big issue for me when I think about why post extended postpartum coverage is so important, because it allows you to set that strong value around family health and wellness. I think that with the, you know, postpartum period, generally expanding that coverage, it also touches on treatment for other chronic physical conditions. So just kind of anything that's creating that touch point back. Um, One of the barriers I think we see is general awareness of this. And so do folks know that they have access to expanded postpartum coverage? How do we promote that better? I mentioned that a little bit earlier, but I think that's where a lot of our opportunity lies as well, is how do we get the word out about this extended coverage? How can pregnancy providers be working towards the end of a pregnancy to help a mom plan that navigation in the same way that you plan to identify a pediatrician for your child? Can we also set up mom with her postpartum follow-up that's with primary care, not just postpartum. You have your postpartum follow-up visit with your pregnancy care provider, but also kind of like a warm handoff to your primary care provider. A lot of times people are coming to Medicaid pregnant because they're now eligible for Medicaid. And so they may not have had a primary care provider before then because they didn't have coverage. And so this is a critical time to say, hey, you've been engaged in the healthcare system. You may have identified some broader physical health or behavioral health needs throughout this process. This is the time for you to get connected with your primary care provider. And so I think that's one of the really big pieces for me and why this is important.
So, as we have worked on our upcoming December issue of the NCMJ, which is all about Medicaid in North Carolina, we've heard concerns about North Carolina Medicaid for pregnant women following the passage of Federal House Resolution 1 earlier this year. With large funding cuts on the horizon, these concerns have been about any Medicaid funded program that isn't deemed absolutely essential, especially considering the relatively recent expansion of North Carolina Medicaid for pregnant women. Do you share concerns about its future?
Yes, absolutely. I think that anything that is not required to receive the federal match for Medicaid concerns me greatly, including Medicaid, the expanded coverage for postpartum. I just think that we're in such a almost crisis in the Medicaid space right now. There's so many things that are up in the air, and I think that's what scares a lot of people. I'm worried that anything, like I said, anything that's not required to be a part of a Medicaid program is has the potential to be cut. But the reality is we don't really know what the answer is. We know that there are likely cuts coming to Medicaid in North Carolina and in many other states. It's just we don't know where. And I think that's what's scary across the board to people because as I mentioned, there's so many benefits to this expanded postpartum coverage. There are so many benefits to Medicaid expansion in North Carolina. North Carolina has been able to cover so many more lives with Medicaid because of the expansion. That's had just amazing impacts on health outcomes and has the potential to continue to have those critical impacts and support rural health systems, really kind of continuing this good work. But we're at a time now where it looks like anything is potentially on the chopping block for Medicaid, which is really scary. So I think ultimately my answer is yes. Like I am worried and I think that it's a risk and it's something to consider. I think we have to be as proactive as possible in terms of advocating for why these things are important to you personally, to your community, to the state. I think that just building that awareness of why this coverage is so critical is really important right now.
Absolutely. I think that's a really good point to wrap this interview up. Just the juxtaposition between just how far North Carolina's come in recent years, expanding access to postpartum coverage, really opening new doors for pregnant people who previously didn't have care, either while pregnant or after they were pregnant. But also juxtaposing that with the current reality that these funding cuts are coming, and we don't necessarily know what that means quite yet. So, I think there's a lot of reason to be hopeful for North Carolina, and a lot of reason to be concerned and very wary of the future for programs like Medicaid for pregnant women. Jessica, I want to thank you for your time today. I really appreciated talking with you and learning more about Medicaid for pregnant women and your perspective on maternal care. This has been an interview for the NCMJ, and we really appreciate your time.
Thank you.